would like to invite Kamal sir, and he would be talking about how to wow tips on delighting your unhappy patient, and he is a master of this. Whenever we are in trouble, whether in clinical or in our patient segment, we always refer the patient to him, and whatever the patient mood is there, when he enters his clinic and when he comes out, he comes laughing. हम सोचते हैं सर ये करते क्या हो, ये जोक सुनाते हो क्या आप उसको? So that is how we would like to basically listen to sir.
So, okay, I think this is a very, very important topic. This actually impacts who we are. How our patients leave the clinic or the room is the reflection of who I was to them. So I always want the patient to go happy because I want the world to know I'm a happy person. So I'll try and roll this 12 minutes presentation in 7 to 8 minutes. So what they didn't teach us in a medical college is a lot of stuff. They taught us the skills, the surgical skills, the clinical skills, but nobody taught us the human relationship, the human interaction, how to take away somebody's pain, how to give a part of your happiness to somebody. Unhappiness is a state of mind. It is always a state of mind. And a state, when you say this is a liquid state, this is a gas state, this is a solid, these are states. And guess what? States can be changed. So if you're happy, unhappy state of mind, be sure it can be changed. You can never say कि ये patient तो ऐसा ही है, ये नहीं बदलेगा. I've never seen a patient, like when a patient says, Doctor साहब मेरा diabetes ठीक नहीं हो सकता. I tell them there is no diabetes which cannot be treated. You're not eating right, you're not exercising, you're not taking proper medication, you're not taking insulin. Period, over. So there is no patient who can not be happy. You should know how to tickle that right spot. So best situation is surgeon is happy, patient is happy. Wow, fantastic. Surgeon is unhappy, but the patient is happy. It's fine. You think something has gone wrong in the surgery, but patient is okay with it. It's best scenario. Then is surgeon is happy, but the patient is unhappy. You can't figure out what's going wrong. Worst is surgeon is unhappy, patient is unhappy. ये medical legal case हो गया 100%. Because you are unhappy, you are angry with the patient, patient is angry with you. So let us see. Human nature, we need to adapt. When Darwin said that survival of the fittest is, well, he didn't mean fittest was the strongest or the fastest was the most intelligent. What he meant was the most adaptable. So we need to be adaptable. The current situation of our practice says that patient outlook is changing, patient demands are changing, we need to change. All patients are aspirational now. आप ये देखिए कि people are having 2 televisions. I remember my father would say, why do people have 2 watches? I myself have 7 watches now. You have 2 cars. Ladies, I'm sure, have 10 pairs of footwear. 10. So the outlook is changing. So why are you feeling bad when your patient's outlook is changing? He wants more from you. So multi-layered patient unhappiness, the reasons are there. There's not just one reason. Don't think that you've done something wrong. It could be patient has had a fight with his boss. It was that there was unruly parking, as Dr. Anjani said. Maybe the reception waiting was long. It's a multi-layered unhappiness. So you need to learn to listen. The moment you start listening, solutions are given by your patient. Believe me, most patients will give you solution to their unhappiness. You just need to listen. We come on a defensive. Patient मेरी clinic के बारे में ऐसे कैसे बोल दिया, मेरे doctor के बारे में बोल दिया, I'm one of the best surgeons, कैसे बोल दिया? You become defensive. When you become defensive, your listening stops. You start listening and you can solve the problem. Sometimes it could be a simple thing like being overcharged. Patient thinks that the bill is too high. Patient thinks the waiting was long. Patient thinks that the receptionist was not good. So a lot of times it's a miscommunication. You have said something, patient has not heard it right. And he's thinking that something has gone wrong. You need to re-emphasize, okay, this is what I meant. I can understand that this is the way you have misunderstood me, but this is the way it was. So make sure that the communication channels are open. Now let me understand. Everybody wants to be happy. Even your most angry patient is looking for you to make him happy. He is not come here to fight. He's come here to show his displeasure. Take the displeasure. Don't give it back. It's like suppose I hand a phone to somebody and he takes it. Do I have the phone with me? No, it's gone. So when the patient is giving you anger, displeasure, complaint, take it. And then say, yes sir, I understand आपका waiting था बहुत ज़्यादा. मेरे साथ भी ऐसा होता तो I would have felt bad. Bilkul, you're not wrong in feeling this thing, but sometimes, sir, these things happen. I'm a surgeon. There was a complicated surgery. I understand your compassion. I'll see you right now, and next time I'll put a word to the reception. How can I make it up to you? How can I make sure that next time आपके साथ ऐसा नहीं हो? Please call your manager. Say, please, yes sir, next time late नहीं होने चाहिए. Sir, are you sure I made you happy? Yes, Dr. Kapoor, I'm so happy, I'm so happy. Next time, can I get my wife also? This is what you do. Take the complaint. Don't give it back. नहीं, ऐसा नहीं होता है. Clinic में तो ऐसे ही होता है हमेशा. So what? We can't help it. So where is the complaint? He's taking it back with him. We can do the same with our spouses. They give you a complaint, take it. बोला हाँ, मैं ऐसा हूँ. मैं संडे को सारा दिन कॉन्फ्रेंस रहता हूँ. मैं क्या करूँ यार? मैं ऐसा हूँ. अभी बताओ क्या कर सकते हैं? मंडे को डिनर चल सकते हैं. So take it away. Approach to the patient is always, when you're seeing an unhappy patient. So what happens is that these people tell me, sir ये आंटी है, बहुत लड़ाई कर रही है, please आपके रूम में भेज दिया. So when the patient walks in, मेरे को पूरा background, I know the whole background. Why is the patient unhappy? But I act as if I know nothing. Hello, Mrs. Basin, how are we today? I believe Dr. Vinita sent you to me. How can I help you? वो तो 50% energy is already down because I'm smiling. I'm not saying, yes, madam, you have some problem? No. Hello, Mrs. Basin, how are you today? Dr. Vinita just told me that you want to see me because she said I want to see the boss. Yes, how can I help you? You're looking very nice, ma'am. Ab boliye, ma'am, how can I help you? Dr. Kapoor, what is this? What is this? What is this? I say, Suppose 10 complaints, make sure you listen and then repeat in the same order and say, okay, so Mrs. Basin, let me tell you, I've heard you. You think that the medications prescribed were over. Okay. Now, the lift was not working. Yes. One of the medicine is stinging your eyes. Yes. The reception counter was more crowded. Yes. So when you narrated all the complaints, what she has said, I've taken it away. She knows she's come to a place where she's being heard. She's come to a place, to a doctor who's listening to her. And then I say, okay, out of these 10 problems, ma'am, 6 are taken care of. 4, unfortunately, are procedures. I can't help. There's a form to be filled at the reception. And you see, Dr. Vinith is a very meticulous surgeon. He likes to take a good history. So you will take 15 minutes for him. And then, after everything is over, I always ask, as Dr. Anjani said, is there anything that we can do to make you more happy? Dr. Kapoor, you made me so happy. Such a fantastic place. So when she entered, she wanted to shoot me. When she leaves, she usually tells me, by the way, Dr. Kapoor, my daughter's getting married 2 months. Can I get a LASIK done? So this is how you change this state. So unhappiness is a state of mind. What you need to do is very, very good listening. To be a good speaker, you need to be a good listener. So first listen, take the patients away. So effective listening, quick thinking, being in emotional control. Never, never, never lose temper. There are times when I'm losing temper because patient is very, very rude to the staff or some lady staff. So what I say is, I tell them, ma'am, I know you're angry. What you've just said is making me a little uncomfortable. Can I just leave you in the room alone? I want to go take a walk after 1 minute because I want to again listen to you. Right now, my state of mind is not letting me listen to you. I just leave the patient. I tell the manager, ma'am ko ek chai do, thanda pani do, main ek walk karke aa raha hu. I just go for 30 seconds, cool my mind, come back again. Then I say, yes ma'am, how can I help you? So the patient realizes, if the doctor can cool himself in 20 seconds, why can't I? I set an example. So you can do that. You tell the patient, ma'am, can I just take 1 minute break, can I come back? Suppose you don't want to be so frank, I'm very frank with the patient. You can just say, ma'am, just sit, there's something very important, I'm coming in a minute. Cool yourself, come back again. Never lose temper with an angry patient because then this is going to escalate. Never be in a hurry, always have an eye contact. And if you have an angry patient, possible to make a body contact. Like a lot of times there's a patient sitting on slit lamp and he's saying this. So what I do is, it's an old lady, I just hold their hand, yes, Maji, मैं आपका problem समझ रहा हूँ. मैं आपका दिक्कत समझ रहा हूँ. Dr. Kapoor बार-बार review के लिए बुला रहे हैं. There's a patient who's got a problem, let's say endophthalmitis XYZ. She's coming with a driver, she's pain. Dr. Kapoor, I'm old, I don't have a driver, I need to take a cab. So then I say, okay, how can I sort it out for you? Hold their hand, call the manager, okay, can we have less waiting for her? Can we have an Uber pick and drop up for her? Can you arrange an Uber on the next appointment? So the patient suddenly feels that the whole system wants to help her. We are not against her, we are with her trying to treat the patient. Whenever, please, as I said, take the complaint away, take the problem away, listen to the patient. Again, when you're losing temper, just relax. Catch yourself that you're going to lose temper. Step back, then start talking again. Remain calm. And once the patient is speaking, please don't interrupt. You can only fill the vessel once it has been emptied. If you interrupt an angry patient, you are not going to make him happy. Let him speak. A lot of times they say, Dr. Kapoor, I have so much to say, but I will not say it. You have such a long waiting. I said, ma'am, I will stop the world to listen to you. I will stop the whole hospital to listen to you. Tell me what is bothering you. And then also, once you finish, ma'am, give me a solution to the problem. What can we do to make you happy again? All the things. Doctor, can you make sure next time come, consultation is not charged, and I'm not taken, I had not made to wait. Okay, ma'am, done. So the patient herself has given me the solution to the problem. Suppose she's been waiting. Suppose there's something wrong, wrong medication, wrong prescription of glasses. Say, what can we do to undo this? The patient will give you a solution. If it's small, do it. This patient is going to get you 3 more patients next time, believe me. Happy environment. Make sure your staff is always happy. They are smiling, they are very jovial. So I always make sure that people around me are happy, they are enjoying themselves, chatting, talking to patients. Kaise hai ma'am? Abhi drop dal rahi hai. If the patient is waiting unnecessarily, as Dr. Anji said, give them something to read. We have a trick. We have our optometrist talking to the patient. Suppose the patients are waiting, one optometrist says, okay, आप में से कितने लोग काला मोतिया के बारे में जानते हैं? He'll just speak for 2 minutes on glaucoma. He'll go. Somebody will say, LASIK के बारे में कौन जानता? So if optometrist is passing, he sees there's nobody there, he'll have a conversation with patients, like public speaking. So patients are engaged, they are connected with the optometrist, they are connecting with the organization. A lot of times patients are having personal issues. Their husband is not well, somebody in the family is suffering from cancer. This is where it comes out, the anger comes out. So a lot of times I tell them, ma'am, whatever you're saying is absolutely fine, I can understand. Is there something troubling you also? Yes, doctor, my husband is suffering from cancer, he's going at chemotherapy, I have to get back home early. Have the empathy. Tell the patient, yes ma'am, we understand. Next time I will ensure there's no waiting, this is taken care of, and you will get a smooth ride. This patient is not going anywhere, believe me. There are times when we book patients, cabs for patients to come and work, always reassure the patient, empathy. If the patient has given a written complaint, make sure it has been complied. The patient is called back that your complaint has been received, we are working on it, and call back to complete the issue. Let's say there was an issue with the lift or the something. Patient has given a written complaint. The manager calls the patient, says, ma'am, this complaint has been taken. We are so thankful you brought it to our notice. Next time you come, please see me and tell me, have we improved to your level of expectation? These patients will drag patients by hair to your clinic. Believe me. This is a simple trick. When people tell me, sir, aap magic karte ho, there's no magic, common sense. Always look for insights, patient will give you feedbacks. There are a lot of times they look angry, but they will give you a very good feedback. Take the feedback, note it, document complaints. And sometimes the patient is not getting sorted out, please keep a written record of the complaint given, action taken, because some patients will go to medical legal. You cannot make all of them happy, and this is where my next teammate will come. And in case the patient says, I want to take a second opinion, encourage it. Tell them, sir, I want you to take a second opinion. There may be something I may have missed. Please help me. Then the patient knows that you're not on an ego, but never be a doormat. It should be done gently, with authority and confidence. Don't become a doormat. Thank you.
Thank you, sir. Thank you very much, sir. And these are the